Good morning, sir.
Good morning.
How are you doing today?
I'm fine. Yeah.
Can I know your name, sir?
I am Dr. Narayan Upadhya.
And you are from which hospital, sir?
I was in the medical college, Assam Medical College, Dibrugarh. I have retired from there. I am a private practitioner there.
Okay. So, sir, since we all know that it is a month of awareness for epilepsy, so not everybody knows about it for now. A lot of people are still in the myth that usko
Epilepsy is still a
right.
mysterious disease.
Right.
Everybody thinks that it is due to possession by the
Right.
evil spirit, and
Correct.
all those things are still
There
there.
are a
But
lot
it
of
is diminishing.
There are a lot of myths related to it. But while we talk about kids at school, so what is the one law that a school should maintain according to you for epilepsy?
Awareness. Or
And how can that be done?
just telling what epilepsy is or what are the diseases the children usually suffer, where they become unconscious, where they behave differently, where they have got sort of funny spells.
So would you say having a workshop in a school would be better, or a subject related to epilepsy would be better?
Both. There is no choice because subject is inside the textbook.
Right.
But then if you have an interaction, probably people will be more aware immediately. You see, whenever you talk to people, the effect is immediate. When you write in the books, it takes time to get into.
Right.
Yeah.
So, are you also saying we should demonstrate to the kids and teach them how to take care of people who's having a strong?
Function of the media, multimedia,
Right.
right? You can do in so many ways.
Right.
You have to create an awareness of knowledge, of inquisition,
Right.
right?
Okay. And also, one more thing I would want to ask you here is that when it comes to epilepsy, what are the challenges a normal person faces?
They are very much afraid of, for the fear should be gone, right? There are so many other taboos. There are so many restrictions. Those should be just meted out. They should be removed. Because, this is one of the common diseases of the mankind. Commonest neurological disease. Rather, I would say this is the commonest neurological diseases of the mankind, right? Which have been feared and misdiagnosed, mistreated, mismanaged, and still it is going on, right?
और साथ ही साथ सर जब किसी लड़के को या लड़की को मिर्गी का दौरा पड़ता है तो बहुत लोग ऐसे होते हैं अरे वो पागल हो गया उसको दौरा पड़ गया है तो ये बहुत नेगेटिव जाता है तो आप उनको क्या बोलना चाहेंगे
एपिलेप्सी को इंडियन लूनेसी एक्ट के अंडर में इसको रखा गया था. दैट इज 1914 जब इंडिया का इंडियन लूनेसी एक्ट बना गया था. इफ आई रिमेंबर करेक्टली इट वाज 1914. और ये जो हमारा न्यूरोलॉजिकल सोसाइटी ऑफ इंडिया हैज कम अप. Now this act has been repealed. It is not there. Now it is not considered as a mental disease.
Right. So, what message would you like to convey to the audience who's watching us right now when it comes to illness? Epilepsy is a mental disease or is it contagious?
Not at all a mental disease. It's a disease just like any other disease. It has got a very high prevalence in the sense around 1% of the population is suffering from epilepsy. Right? So one has to be very sure that this is not a disease to be feared of. Rather, it should be tackled, it should be handled, it should be challenged. Right? And then only we can overcome it. This problem is going on for centuries. Actually, epilepsy is probably one of the oldest diseases of the mankind. When the man was born, and some of them got head injury or infection or any sort of such problem in the brain, right? So this is one of the commonest brain disease which have been yet not given due importance for the management. You see, there are so many things I like to tell about epilepsy. One is people should have a proper knowledge about epilepsy, proper concept rather than knowledge, proper concept of epilepsy. They should not be afraid of. Rather, they should challenge it. They should face it, right? And then second, the knowledge should be spread. Most people, what they know, they keep to themselves. Actually, this should be spoken out. They should be spread it out. Then only the knowledge actually gets, the proper place of its importance, right? So then the third is even the government has to do a lot of things. Besides creating awareness, even the common anti-epileptic drugs, simple anti-epileptic drugs should be made available to the hospitals, general hospitals. Right? They can make condom available, anti-epileptic drugs can also be made available, and this should go only through prescription. Only one restriction is that it should go through prescription only. It is not a a drug that over the counter somebody will take at his pleasure and stop it whenever he likes. It should not be, because it has got a definite pattern, a design, a sort of a way how you have to take, and he should take continue. Then another important thing is, here your patience is actually tested. Because it's not a disease that you can treat for 1 or 2 months, then you stop if you do not find any symptom. It should be continued. And the discontinuation of the drug or cessation or stoppage of the drug is as important as the beginning. Right? In the beginning also, you have to counsel the patient, you have to talk to the doctor, know thoroughly about the disease and also the medicine. Then he or she should continue the medicine with religious sincerity. Religious sincerity. In religion, people are very sincere, no? So I use the word religious sincerity. Then they should continue till a time when the doctor says that, yes, now we can pause and ponder first to decide whether it is the right time to reduce the taper of the dose, then stop it, right? That should be under supervision. Stoppage of medicine should not be unsupervised, because there the problem may arise. The patient might have one seizure or multiple seizures when you stop the medicine. So during that time also, one should be very cautious and careful. And then if you find that, yes, this is gradually it should tapered off and stop.
Thank you so much for your words, sir. I
Actually,
think
the patient's confidence is more important. And this is a disease not only of the patient, it is a disease of where the entire family is affected. All his relatives are affected. So all should know that so-and-so was having a problem. Now the problem is controlled. Now she is better. So treatment has worked, and this should be continued, and the message should go to other people also. See with treatment how a good life can be led. And there is no restriction. Another thing is that people with epilepsy are generally barred. You see, one should not use the word epileptic patient. Rather, they should be given a dignified term called patient with epilepsy, patient with certain disease, with certain problem. And they should continue the treatment with, they should be able to tell that, yes, I had the problem, now I am okay. Very proudly, they should be able to just declare in the society, right? And they should not just retreat.
right. So emotionally, mentally, both should be equally
In
okay.
all aspects, they should be all right. Right? All right means not only that they do not have seizure, but the fear should also be gone, and the conviction should develop within them that I am all right, I can do anything. Rather, they should be encouraged to rise, study, play, right? Because you see, they were devoured for so long. Now they are open and they can just unfold themselves to their full potential. That's what I want. Thank you very
That's
much.
great. Thank you so much, sir. Thank you.